Hello everyone. I'm Dr. Vidal here at Pure Plastic Surgery, and we are back with Tuesday Tips. We try to meet every Tuesday afternoon to discuss different topics in plastic surgery. Sorry for my voice. I was screaming and yelling in the Puerto Rico versus Venezuela game on Sunday, and now I don't have a voice. It's coming back, but it's getting there. So if you don't understand anything, just write it in the messages. And today we're going to talk about cellulite. Why? Because we just got a new treatment option for cellulite here at Pure. So I've been getting a lot of questions about it. So I'll explain a little bit about cellulite and obviously about this treatment option, and then we'll get to some questions, okay? So cellulite, it's unfortunately genetic, okay? So although it's very common, say approximately 90 to 95% of women have cellulite, so it's not related directly to diet, exercise, although if you keep a healthy diet, you may improve the appearance of cellulite, but you can have a very strict diet, very strict exercise routine, and still have cellulite. Why? Because cellulite is actually fibrous bands that form between the muscle and the skin. So this lovely diagram that I did here pictures a little bit about that. So this blue line resembles the muscle, so it's like you're seeing it on the side view. You have the muscle, the green one is the skin. So the space between the skin and the muscle is called the subcutaneous space. That's where the fat lives. That's where when we do liposuction, we empty that space. So in that space, we have those fibrous bands. They're made of collagen. And what they do is they attach the skin and cause that dimpling in the skin, okay? So the other thing that is important to understand is that skin laxity sometimes makes the appearance of those bands worsen, and sometimes it's not actually cellulite. And when you see, especially when it's not a dimple, it's more like lines in the thighs, specifically sometimes in the glutes. It's actually skin laxity. How can you differentiate? Just put two fingers and pull the skin up a little bit over the area of the depression. If it gets better, then unfortunately skin laxity. If it doesn't get better, if you still see the dimple, then it's cellulite, an actual fibrous band, okay? So what are like I mentioned, diet and exercise may improve because diet and exercise will decrease the space or the amount of fat in this space, which makes that dimple shallower or not as deep. If you increase this space, because this is attached here, if you increase the thickness, so if you gain weight, increase that thickness, this dimple is going to seem more pronounced, more deep, because those bands are kind of holding that down, not letting that stretch with the rest of the thickness, okay? So diet and exercise is always good, and it'll make the appearance better, but genetics-wise, like I mentioned, if you do have cellulite, it's not going to go away completely. So what are the options here, right? So there's this Avali, it's called Avali. It is a minimal invasive technique to remove or cut those bands, okay? So it is done through small incisions, smaller than lipo incisions, depending on the location of the cellulite. Usually do it in the gluteal fold, so it's easily hidden. But if you have some dimples in the outer thigh, you may need another incision access point to reach there. And it can be done under local anesthesia here in the clinic, or if you're having another procedure, it can be done at the same time in the operating room under general anesthesia while we're doing a mommy makeover, breast procedure, liposuction procedure. So how it works is I do that small incision and then place this cannula in this space, in the subcutaneous space, over to where the band is. This is a demonstration cannula, so you can't really see it here, but if you can see here at the tip, there is a light. It's not turned on right now, like I said, because this is a demonstration one, but this turns on. So when I insert this, I can see it translucent through the skin, the red light, to make sure that the tip of the cannula is where it needs to be, right in the dimple, okay? So once I put it in, it actually has this little cutting blade there. You can see that it moves when I move this. So I put it in, make sure that I am right under that dimple, and I can cut that little band and then get rid of this, and this then goes away, okay? So like I said, it can be done under general anesthesia, or it can be done locally here, only one treatment. What's the downtime? So when you come in, you'll have bruising, you'll have swelling because it involves cutting, right? So your body's gonna have a response to the cutting, and yes, there will be bruising, there'll be some soreness, and there's gonna be swelling. The swelling and bruising may take up to 30 days to resolve, so don't do it just before your cruise vacation because you're gonna be all bruised up. Plan ahead so you have plenty of time to recover. You have to use a compression garment. Doesn't have to be a full faja, but something tight so you keep compression in the gluteal region to decrease swelling. You may put some ice also. You can sit, okay, so you don't have to be like in a BBL, avoiding sitting or sleeping in your belly. No, you can sit after the procedure. You may be sore, but you can sit. You won't damage or affect anything. And like I said, the swelling is going to last approximately 30 days, and after that, that is it, okay? You see the final result at 30 days once the swelling comes down, okay? The incisions still need to be stitched up. They're, like I said, smaller than liposuction, so they close on their own, okay? So that's Aveline, okay? And I included here the BBL part because although it can be combined with a lot of the procedures I do here, I do not combine it with a BBL. Why? The BBL, I am putting fat in this region, okay? So this is the region, the subcutaneous space is the region where I'm injecting the fat. We need this bands to hold the skin in place to distribute the fat in that space evenly. What happens if I cut this band and I fill it with fat? Then I'll show you here with my little diagram. Then there's no support and the skin may go like this, filled with fat, and cause a blowout deformity, okay? So that is why it is not recommended to combine the cellulite treatment with the BBL, because then instead of having a dimple, you'll have a ball, and we don't want that, okay? So when to do it? You can do it 6 weeks before or 6 weeks after the BBL. Depends on the severity of your cellulite, when is the best. For the majority of patients, it's better to do it after. Why? The appearance of cellulite may worsen with a BBL. Why? Same thing as I explained when you gain weight. If you have a dimple here, and I fill this with fat, this area is gonna expand, and this is gonna expand, obviously prettier than this, and this dimple is gonna be more noticeable, okay? So that is why a BBL may worsen the appearance of cellulite. So it's better to get the BBL, see how much it expands, see what areas worsen, and then we do the Aveline treatment to kind of even everything up and get rid of the ones that bother you the most, okay? Aveline or any type of cellulite treatment will not get away or remove every single cellulite in the buttock or hip thigh area. Why? Because it's important to have attachments of the skin to the muscle. We can remove the ones that bother you the most, the ones that are more noticeable, but we don't want to separate the entire skin and muscle area, because then the fat may droop and you may have what's called buttoctosis or buttock droopiness, okay? So the attachments are important. They keep things in place, and we may remove some of them to get a better appearance, but not all of them. And the other area that it's not recommended to do Aveline is around the gluteal fold. That's a very important area to establish the anatomy. The one in the bottom of the buttock, that area, some people call it the banana roll. That area is extremely important to keep those attachments. If we don't have those attachments, then you have a continuation from the buttock to your thighs, and we don't want that, okay? We want that shape and that fold to be preserved. So if you have cellulite 2 centimeters above or below what's the actual fold, that is not an area that we can do Adley, okay? So those are the indications, contraindications, and remember, not combined with a BBL, but any other procedure can be safely combined, okay? I'll take some questions now if you guys have it.
Okay. Let me pick first from the topic.
Yeah.
Okay. A belly can be done on my abdomen.
So abdominal cellulite is extremely rare. Cellulite is more in areas of dependent areas, so buttock and hips, thighs area. The abdomen is not a common area, so if you have a dimple in the area, usually it's due to post-surgical scar or other reasons. So we'll have to send a virtual consultation form with some pictures so I can evaluate your particular case and we can determine if you're a candidate or not.
After a tummy tuck, when can I start sleeping on my belly?
After a tummy tuck, you should be sleeping in your back for the first 6 weeks. The first 2 weeks, you should be sitting a little or sleeping a little bit bent at the waist. So doesn't have to be sitting all the way up, but we call it beach chair position. So a little flexed in the hip. And at 6 weeks is when you can start sleeping in your belly.
Okay, any advice on how to get my white blood cells higher?
White blood cell count is a count in our body that tells about inflammation, infection, and it's basically our army response, right? If you have a low white blood cell count, it may be related to medical conditions, okay? So I'll have to evaluate your case specifically to see what's the reason, and see if you're taking any medications that may be decreasing that, if you have any immune diseases that might decrease it, and take it in case-by-case basis.
How soon after an arm lift can you do a lower body lift?
So you should wait at least 3 to 4 months to have the arm lift healed before getting another surgery, especially a lower back lift, because you'll need your arms to be moving around, and we don't want the incisions and the areas of the arm lift to open up or dehisce.
Ok, en español.
Yeah.
¿Cómo puedo hacer una cita presencial?
Bien fácil. La manera más fácil es a través del website, o si vas en mi Instagram, en mi cuenta de Instagram vas a ver un link que te va a comunicar al website de Pure Plastic Surgery, o Google pureplasticsurgery.com. Vas a entrar a nuestra página y vas a ver un link que dice Virtual Consultation, consulta virtual. A pesar de que tú quieras hacer una presencial, tenemos que hacer este proceso antes. ¿Por qué? Porque este proceso nos va a decir una información básica tuya de tus condiciones médicas, de tu edad, de tu peso, y de las fotos y las fotos tuyas y el procedimiento que tú vas a querer hacer para yo poder darte una evaluación previa y entonces coordinar contigo la presencial.
Do you explant procedure with muscle repair and lift?
Yes, it is possible. That is basically a mommy makeover. So a mommy makeover is any procedure where we're combining a tummy tuck or the muscle repair with removal of the skin with a breast procedure. So if you had or you have breast implants and you want them to be removed and have a lift, then we can combine it with a tummy tuck. It will be a mommy makeover.
And the last one, and then this is very easy for you, it's what's your BMI requirement for surgery?
Excellent. So less than 33.5, but I encourage everyone to be closer or lower than 30. Why? Increased risk of complications, and your results will be better so the risk of complication decreases when your BMI is lower than 30. what complications, blood clot and wound healing complications, and also your results are going to be much better if you are closer to your ideal body weight. Awesome. Thank you so much, you guys. If you're interested in the Avali, also do a virtual consultation form and a coordinator will be in contact with you and explain all the details and help you schedule. And if you have any questions, also through Clara, phone, or DM me with your questions and I'll get to you, okay? I'll see you guys next week on Tuesday Tips with Dr. Rita. See ya.